The impetus for this study came out of our clinical practice where people with venous disease and a history of ulcers experienced many negative symptoms and they had poor quality of life. So we undertook this project to see if we could augment standard of care, which was compression stockings, leg elevation, some exercise. A lot of people don't wear their stockings, and we thought maybe there could be something else they could do to improve their symptoms. So what we decided to do, and this was based on a whole lot of work in the past, is to use a cooling therapy, which was a cooling cuff we had made. They applied it to their lower legs over a dosed sequence over a 9-month period of time. And we randomized 276 individuals to receive the cuff or a placebo cuff, which looks similar, placed in the refrigerator, in the freezer actually. And they followed standard of care and also took temperature of their skin before and after the treatment with a long-handled thermometer just to make sure that they were getting the cooling, and also to make sure that kind of helped us with measuring adherence. So what we found was with an instrument called the VEINES Questionnaire. We measured quality of life at 5 points, baseline, and then during the study and end of study. And we found that the cooling therapy, both in the total score for quality of life and the symptoms, improved in both groups, but this was not statistically significant. However, what we did find, which was interesting, there was an age by treatment interaction, meaning people 65 of age and over had statistically significant improvements in their quality of life scores and their symptom scores. Another interesting finding was that females were more susceptible to cooling, meaning they had the largest out of the sexes, between the sexes, improvement. And also people who were not working, who lived in rural areas and who were married, achieved greater improvements. So what we concluded was that cooling does influence quality of life. And in clinical practice, what this means is we found that if they use the cooling cuff 3 times during the week while they're elevating their legs, they had great benefits, and it also reduced the incidence of venous leg ulcer recurrence. Thank you.